Aisha was 16 when she noticed something strange about herself. Some months, her period came right on time. Other times, it would disappear for weeks and sometimes months without seeing it. Let's not talk about the pain Aisha had to go through every time she is on her period. Sometimes Aisha could not even get out of bed. And also when this period surfaces, it's either it's too heavy or too light. At first, Aisha thought it was normal and nothing to worry about. But deep down, Aisha kept thinking if this was trying to pass a message about her health. Aisha decided to confide in her friend Zara, yes, her best friend Zara. And Zara told Aisha that something similar happened to her and she had to see the doctor. So after hearing from Zara, Aisha decided to visit the doctor, and the doctor explains to Aisha that sometimes our period gives us clue about our health. Good day everyone and welcome back to Nurses Lecture Room. My name is Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today on this video, I'm going to be sharing with you, I'm going to be explaining what your period says about your health. So the first one I would like to share with you is irregular period. So if you are a lady and you are having irregular period, it could be passing a message about your health. If your period is coming too early, too late, or you are skipping months without seeing your period, it could be as a result of stress, it could be as a result of hormonal imbalance, and it can also be as a result of a particular condition called polycystic ovary syndrome. If you are exercising too much, if you are losing weight, and also if you are gaining weight, your body may react that way by making you have irregular period. Then the third one I have to share with you is having heavy periods. So if as a lady you change your pad or your tampons every 1 hour or every 2 hours, it's already soaked, it's already filled up, it could signify fibroid. It could signify hormonal imbalance, and it could also signify anemia. You can see even anemia is there. So if you are feeling dizzy, fatigue during your period, that could be a sign that you need to see the doctor as soon as possible for proper evaluation. Then the fourth one I have to share with you is if you're having spotting between your period. For example, you saw your period today. Before your next period, you are seeing spotting, you are seeing light bleeding. That could be as a result of stress. It could also be as a result of infection. And it can also be as a result of changes in your birth control method. And if you notice this light bleeding, it can be as a result of something more serious, such as hormonal problem or even pregnancy. Then the fifth one I have to share with you is changes in the period color. When you have a red blood, that is fine, it is normal and it is fresh, we understand. Then also if you have a brown period color, it just signifies is an old blood, so that is normal, that is okay. But if you have this grayish and smellish period, that could be a sign of infection that you need to take note of. After learning about all this, Aisha spoke to her mom and they visited the doctor again, and they carried out some tests on Aisha, and the doctor found out that Aisha had polycystic ovary syndrome, which I explained at the very beginning of this particular video. Aisha was given some medications and they advised her on some lifestyle changes. With these lifestyle changes and also medications, Aisha's cycle was getting back to normal gradually, and she was living a happy life. She understood herself better, she understood her cycle better, and she understood what was going on in her body better. So what I have to tell you in regards to Aisha's story is that when you notice something strange about yourself, we are talking about your period today. If you notice notice something strange about your period as a lady, you can speak to a friend, speak to your mom, preferably speak to your doctor. Talk to your doctor about what you are experiencing at that particular moment. Let them run the test. Like I will always say in my video, it is better for you to visit the doctor and the doctor do their test and tell you, oh, you are doing okay, you are perfectly fine, than for you to assume, oh, it's a normal thing, and something is actually wrong. The earlier you see the doctor, the earlier you get treatment, the earlier things are being sorted out. But if you fail to see the doctor and you keep procrastinating today, tomorrow, oh, I'm fine, it's going to come back to normal, then you are making everything worse. One good thing about Aisha was the fact that Aisha confided in her friend. And also one good thing about her friend was that she did not advise Aisha to take the same medication she's taking. She did not advise Aisha to do what she's doing, but rather advised Aisha to visit the doctor. Sometimes as ladies, when we experience something and we speak to our friend about it, we tend to use their own line of treatment rather than seeing the doctor to get our own specific treatment. You can see, no matter what you notice in your body, please and please, if you notice any deviation from normal, please and please speak with your doctor for proper guidance and treatment. Your period may be telling you something about your health that you are not listening. Try and listen to your body, because the earlier you start listening to your body and seeking help, the better for you. So thank you very much for staying tuned. Thank you very much for watching this video. I hope you got value from it. And if you got value from it, kindly share with your friends and all the women around you. Bye and see you in our next video.